This presentation is on drugs for the respiratory system, and just a note, it would be a really good idea to make sure that you have viewed the presentation on the respiratory system from physiology, because that will give you a background on the structure of the system and how the respiratory system works. Just a quick review, our upper respiratory system consists of structures from the larynx upwards. So the larynx is our voice box. It houses the vocal cords, and it's found in the upper part of the trachea. So all of the structures that are involved in our passage or our conduction of air down into our lungs, like our nasal cavity, our oral cavity, larynx, pharynx, which is the fancy way of saying throat, our sinuses, all of those structures make up our upper respiratory system. So when we look at what sorts of illnesses can affect these structures, there are things like the common cold, which can give us a runny nose and can congest the nasal cavity, can also cause congestion of the sinuses, hay fever or allergies that affect the sinuses, infections can affect our sinuses, inflammation of the larynx, which is laryngitis, or inflammation of the pharynx, which is pharyngitis, that's the fancy way of saying it, or inflammation of our tonsils, which are found right at the very top of the pharynx, and that's called tonsillitis. So all of these types of upper respiratory disorders produce a set of symptoms that we can treat. Most of these disorders are caused by viruses, and so if it's caused by a virus, we don't have a medication to treat that underlying cause, but we do have medications that can treat the symptoms, like things like a sore throat or congestion or sneezing, runny nose, cough, fever. So the drugs for upper respiratory disorders primarily treat symptoms and not the underlying cause. The exception is that if it was a bacterial infection, then we could use an antibiotic. A couple of slides of dating fun facts for you. So first one, which of the following is a trigger for sneezing? Irritation of the nasal cavity lining, bright sunlight, sex, exercise, or all of the above? And the answer is all of the above. And that's because sneezing is a reflex pathway. And although sneezing is designed to get rid of something that's irritating our nasal cavity, that reflex pathway can be triggered by a number of other things, including sunlight, sex, exercise, as well as things like drug withdrawal, gastric distension, a seizure, sometimes psychogenic factors. So something that we think about, menstruation, if we lower our body temperature, or even things like plucking your eyebrows can trigger that sneezing reflex to occur. Here's a couple more sneezing facts. Which of the following facts about sneezing is not true? So 1, you can sneeze in your sleep. 2, the sneeziest animal is the iguana. 3, sneezes travel at about 150 kilometers per hour. And 4, a sneeze cannot be stopped once started. And the answer is the only one of those statements that is not true is number 1. So you cannot sneeze in your sleep. So a sneeze produces about 40,000 aerosol droplets that travel at about 95 miles per hour. But some of those smaller droplets can reach speeds of up to 650 miles per hour. And as I think we talked about in physiology, the large drops travel 2 to 3 meters, but the smaller drops can travel much farther, particularly if they get suspended on the air, they can travel very large distances. So if we look at upper respiratory congestion, so a stuffy nose, stuffy nasal cavity, stuffy sinuses, this is caused by irritated mucous membranes that line these cavities. And so when they're irritated, the blood vessels dilate. We get that inflammation that occurs. Blood vessels dilate and fluid leaks into the surrounding tissues. And that causes swelling of those tissues. And in a response to try to get rid of whatever is irritating it, mucus cells start to produce mucus. So this irritation can be caused by bacteria or viruses. Usually a virus that causes congestion is a type of rhinovirus, or the irritant can also be an allergic inflammatory reaction to something that you've inhaled, so dust or pollen or things like that. So for all of these symptoms, the best treatment is something that is non-drug related. And there's a number of reasons for this that we'll talk about as we go through this presentation. So the ideal way to treat nasal and sinus congestion are with what we call home remedies, so non-medications. So things that can relieve congestion are steam inhalation, so inhaling warm steam. So for example, having a nice warm shower or a sauna. Sometimes aromatic oils like menthol or eucalyptus can help also thin the mucus and promote drainage. What this woman is doing, this is called a neti pot, and this is called nasal irrigation. And so this is where water is actually pushed through one nostril. It goes up, flushes the nasal cavity, and comes out the other. And this can be done for infants as well, to try to flush out that nasal cavity and get rid of some of that mucus. A humidifier or a vaporizer. There are saline nasal sprays, so the saline is just a salt water. Propping yourself up to promote drainage, and also warm compresses that you put just over your cheekbones here and on your upper forehead. That will also help promote drainage and thin that mucus. So if that congestion is causing sinus pain, or you're not able to sleep at night, and remember, sleep is of the utmost importance if you're trying to boost your immune system and get rid of a virus, then you can relieve congestion with decongestant drugs. So these should be used if home remedies are not effective and if that congestion is something that you just can't live with at that particular time. So most decongestant drugs are sympathomimetic. And we've talked about this word before. Sympatho meaning the sympathetic nervous system, mimetic meaning it mimes it. So these are drugs that act or mimic the sympathetic nervous system. And if you remember the sympathetic nervous system, it's the one where if you're really scared, so if there's a big crash in your basement and your pupils dilate and you get ready to either run away or you get ready to fight, whatever it is that's in your basement, your sympathetic nervous system gets activated, and it causes an increase in blood pressure, and it causes an increase in heart rate and increased blood flow to your muscles, and so you're prepared to be able to run away or fight or flight. So these types of drugs, when they're taken, they act to constrict or narrow the blood vessels in the nose, the pharynx, and the sinuses. And that then allows less fluid to leak into the tissues. And so the mucous membranes are reduced in swelling, and that relieves the congestion. So this is really, it can be very effective over the short-term treatment. Drugs that you might recognize in over-the-counter types of medications are things like pseudoephedrine or phenylephrine. So they act just like epinephrine, which is the neurotransmitter that the sympathetic nervous system uses. So some really important points with decongestant drugs. Because it mimics the sympathetic nervous system, it's going to increase heart rate, and it's going to create some irritability, just like as if you had this big scare in the basement. So your body will have those same physiological effects. So the side effects can be anxiety. Sometimes it can promote seizures. Definitely will increase heart rate and cause perhaps heart palpitations, hypertension or high blood pressure, and a headache. So for people that have cardiovascular disorders, these types of drugs may need to be avoided because they can put stress on the cardiovascular system. The other thing you may have noticed is if you've ever taken a decongestant and it works, that when the medication wears off, those mucous membranes suddenly produce excess mucus. So we get this rebound effect, and you end up more congested once the medication wears off as you were when you first took it. The last thing that I would like to mention, and this is a star. So in 2009, Health Canada conducted a review of decongestants as well as a number of other over-the-counter cold medications. So cough syrups, expectorants, as well as decongestants. And so they looked at these cold products in children, and they found no real evidence that these products are effective in children. And on top of that, children under the age of 6 are at risk for some very quite severe side effects. So there is a contraindication that no decongestants, or for that matter, any other type of cold medication, we'll talk about those in the next couple slides, should be given to children under the age of 6. Coughing is another reflex that our body uses to expel harmful substances from our respiratory tract. There are receptors. These receptors are both mechanoreceptors, and chemical receptors in the respiratory tracts themselves, in the lining of our heart, in our esophagus, which is the tube that goes into our digestive tract, in our diaphragm and stomach, and these send signals up to the cough center, which is in our brainstem, right in the medulla. And the medulla then sends nerve impulses out to all of our expiratory muscles, so our diaphragm and intercostal muscles, as well as to muscles that line the larynx, our trachea, and our bronchi. And it can cause all those muscles to contract, and this can create a big forceful push of air to expel whatever it is that's irritating the lining of our respiratory tract. So that's what a cough is. We have two types of coughs. We have a productive cough, which is a type of cough where there's lots of mucus there in that cough, and you can hear that kind of gurgly cough. And then there's a non-productive cough, which is a dry cough. So this is really important to distinguish because the type of medication that you will use will be different for whether or not you are actually producing mucus or whether or not it's just a dry hack. And the primary difference is that if you are coughing to expel mucus, then you want to continue to cough because you don't want that mucus with all of its microorganisms stuck down in your respiratory tract. So productive coughs, a person should be allowed to cough. We don't want to suppress it. We want to expel all of that mucus. So most cough remedies are used to treat non-productive or dry coughs. So these types of medications work by either suppressing that cough center in the medulla, or sometimes they work by anesthetizing or numbing those receptors in the respiratory tract so that they don't respond to irritants. Again, these types of medications should only be used for dry coughs, and really only if the cough is really inhibiting a person's ability to get better. So if a person is coughing so much that they are exhausted, or they're coughing so much that they start to get rib pain or chest pain, or they can't sleep at night, so then we really need to treat these dry coughs. Otherwise, it would be best to let our immune system take care of it and not use these types of medications. There are two main types of antitussive drugs, which are cough medications. I always remember that because antitussive kind of sounds like a cough. Antitussive. Anyway, maybe that is just me, but you might be able to use that to remember it. There are two types of antitussive drugs. Narcotic drugs, so are drugs that are things like codeine or hydrocodone. And these drugs act in the medulla, and there are receptors for them in the medulla, and they will suppress coughing. These drugs also, of course, are used to treat pain as well. So usually narcotic drugs are reserved for very severe non-productive coughs, and they are prescribed. You can get some over-the-counter cough medications that have codeine in them, but that's at a fairly low dose. Cough medications with hydrocodone in them have to be prescribed by a physician. So there was a very recent review, and it's still going on, of over-the-counter cold medications. And so Health Canada looked at narcotics in cough medications and in other cold remedies. And what they have recommended is that no children under the age of 12 should be given over-the-counter narcotics, so cold remedies or cough syrups, antitussives that contain codeine or hydrocodone in them. And part of this is linked to some research that looked at taking narcotics at a very young age, and that it increases the risk for substance abuse later on in life. So although Health Canada has taken the stance where cough medications that contain codeine and hydrocodone shouldn't be given to children 12 and under, most researchers in the field believe that teens under the age of 18 should also not use these types of cold medications. The most common type of antitussive drug that you'll find in the pharmacy are non-narcotics, and they also should not be used for children under the age of 6. And the most common one, and I would like you to remember this drug, is called dextromethorphan, or DM. And if you look on the box, and it'll say Benylin DM or Robitussin DM, the DM stands for dextromethorphan, and that is the active ingredient. It also works directly in the medulla. The third type of medication that will treat cold symptoms are expectorants. And expectorant drugs are taken orally, and they loosen up the mucus secretions that are in the respiratory passageway and makes them more easily expelled. So a person that has a productive cough and they've got lots of mucus and they have that heavy chest feeling, they could take an expectorant drug, and that will help them expel some of that mucus. The most common type of expectorant drug over the counter is guaifenesin. So I would like you to make a note of this, because expectorants are ideal to treat productive coughs, but antitussives shouldn't be given to somebody with a productive cough. Often these two medications are found in the same over-the-counter product. And this is paradoxical to me, because we want to loosen up the mucus, but we want that person to be able to cough, to be able to expel that mucus. So these are things to watch for, and we're going to talk about that in a slide or two. Again, children under the age of 6 should not take this. The other thing is if a person can't cough very much, or they have a chronic cough, such as if they have chronic obstructive pulmonary disease, so things like asthma or chronic bronchitis or emphysema, then they shouldn't take this, because they'll loosen up all of this mucus but not be able to expel it. Just another note about this is that one of the most effective ways to loosen up mucus in the respiratory tract is to increase your fluid intake. So it loosens and liquefies those secretions. So that's why they say drink lots of fluids. A mucolytic drug is slightly different. It also decreases sputum thickness. It makes it less sticky and more easily coughed up. These types of drugs are the ones that are used to treat chronic conditions like asthma or cystic fibrosis. They can be inhaled, so they can be put into a metered dose inhaler as a liquid. They can be taken orally, or they can be injected. So Mucomist is a common brand name of a mucolytic drug. Okay, star. So this is what I was speaking about earlier, is that many over-the-counter cold medications combine all of these products together. So a similar product that says, for example, cough and cold might contain an expectorant to loosen up the mucus, a decongestant, which is to decrease inflammation and congestion in the nasal cavity and sinus, as well as a cough suppressant, and it may have a drug to reduce fever, and it may have an analgesic to reduce pain. And so some of these remedies will contain combinations or maybe all of these drugs. And as I said, sometimes taking 2 of these drugs is counterproductive, so to loosen up the mucus but not be able to cough it out, for example. So I think it's important to really read the beyond the title of a over-the-counter cold medication. So thinking I've got a cold, so therefore I'm going to take cough and cold. And you say, I've got all these symptoms, and so therefore I need all these things. So a more educated approach to over-the-counter cold medications, I think, is needed. And I think we need to look at the ingredients and, am I taking a narcotic? Is this an antitussive? Is this an expectorant? What are my symptoms, and what do I actually need? There are a few other things you'd want to look at as well. So sometimes cold medications contain a lot of sugar. And so if somebody is diabetic and they are keeping track of their sugar intake, then it might be important to be able to know how much sugar is in that as a non-active ingredient. Okay, this is the end of the first part of this presentation. And part 2, we'll start looking at allergies.